Heart disease is the silent killer. Its devastating effects can tear families apart in an instant. Marriages destroyed, children abandoned without parents and grandparents.
Half the people who have a heart attack have no symptoms prior to their heart attack.
I had an uncle who was an avid cyclist, totally normal weight. He had a good total cholesterol level, and he was biking one day and he collapsed on the side of the road, dead. No warning.
So my mom, she died suddenly of a heart attack in her 50s, 56 years old, and nobody knew she had heart disease. She died.
My father had passed away when he was only 51 from a massive heart attack. And he had been doing all the right things from a traditional point of view. He really believed in traditional medicine as a scientist himself. So he took all the right medications and statins and was getting regular checkups, but still this happened.
Heart attacks, strokes, high blood pressure and cholesterol, erectile dysfunction, painful extremities, heart failure and more. It's bound to affect us all.
This could happen to anyone, any gender, any socioeconomic class. So we have to always keep that in mind. It's still the #1 killer in this country and in the Western world.
It can span any age range, and women are not spared. For women as well, cardiovascular disease claims 500,000 lives a year versus breast cancer, which claims maybe 46,000.
But if you think about people who are at risk, we're talking about probably half the population.
And with cholesterol-lowering drugs holding the record for the highest revenue drugs of all time, heart disease is not only a big problem, it's big business too. But are we being told the truth about the multi-billion-dollar heart disease industry?
It's absurd that we talk about lowering cholesterol. It doesn't make any physiologic sense. The only reason that we talk about it still is that we have drugs that lower cholesterol.
George Mann, a name worth remembering, he was one of the top researchers on the Framingham study, which is the cornerstone of all of our thoughts about heart disease and diet, called the notion that cholesterol causes heart disease the greatest scam ever perpetrated on the American public.
50% of people that have heart attacks have normal cholesterol levels, and I was one of those.
What if people are tragically dying without being given access to therapies that truly work, while being exposed to toxic drugs with side effects, such as type 2 diabetes, cancer, Alzheimer's, muscle and joint pain and more? The story you're about to hear will shock you.
A lot of people don't like this, but the doctor's not your friend. The doctor is the representative of the healthcare industry, a big business whose primary goal is to increase revenues.
It's really sad for the medical doctors because that's all the average medical doctor can do. We're not trained in nutrition, we're not trained in lifestyle, we're not trained in natural remedies. We're trained in pills and pills and pills.
That formula, cut your fat, take statin drugs, does not work.
Welcome to the untold story of heart disease.